Hello, today we're going to talk about lateral hip pain, which is really pain anywhere around this big bony outcrop of bone that you have in your thigh, and it can travel down the side of your leg and very occasionally below your knee. Now it can be confused with sciatica, but it shouldn't really produce pins and needles, tingling or numbness. Now often this pain is caused by the tendon at the side here. So in this video we're going to look at ways to just slightly offload that in every day-to-day activities. Once you've tried that, then you want to gradually try and strengthen that to help improve symptoms. So if we look at sitting to begin with, so with sitting what you want to do is avoid really low chairs like couches for example, and you want to avoid anywhere where you're crossing your legs. Both of these things will add quite a lot of compression to this area, which if at the time it's okay, you'll often suffer for that later on. So for example, with this chair here, I wouldn't want to go any lower than this, and indeed I would probably, if I had lateral hip pain, want to raise myself up slightly, if not a wee bit more. Okay. The other thing to think about is the position that you have your knees. You don't want your knees together, you want to try and get them out as far as you can. Again, this will just offload this area of your hip. When we look at sleeping, so again, sleeping is often a big problem for people because the direct pressure onto that area is a problem. What you want to do with this is either lie on the other side or lie on your back. So if you're lying on your back, if you can, try and put a wee pillow to support your knees, and try again and keep your feet quite far apart. That will help to offload that. If you're going to go onto your side, what you want to do is, if say for example my right hip is the problem, I'm going to lie on my left side. And what I would do is, now you want to use quite a lot of pillows here. I think the problem is people often just try and use one. So with this, that's probably okay, but again, I could maybe do with another one underneath my foot to just make sure that this is elevated up high enough. You often find that it's activities that we do on one leg. So for example, running, walking, going up and down stairs are often common aggravating things for this. So again, if you have a walking aid, please use it. It will often be helpful. Again, if there's a banister going up and down stairs, use that, or try and go up one leg at a time. All these little things will often help to reduce the general irritation. Once you've done that, then you can commence on your strengthening. Hopefully these are useful to you. Thank you.